Welcome back to Spine and Sports Therapy Kingwood. You are watching our video series on mobility. My name is Dr. Matthew Brackney, and today we're going to be going over a foam rolling technique or exercise for our low back muscles, specifically those back strap muscles that run along either side of our spine. There's a couple different ways to get some good muscle rolling into these muscles. And I'm going to show you two ways that I've used that I've had good success with. Now, I will say this: if someone has low back tightness and pain, there are actually two other stretching and rolling exercises that I recommend, specifically the glutes and the hip flexors. I'd encourage you to check out those videos when you have a second on this channel as well. But nevertheless, working these back strap muscles, these muscles on either side of the spine, are important as well. To roll out to get to some of that deep muscle work. Foam rolling is of course really good for what's called myofascial release. Their fascia is a connective tissue that's inside of our body. It wraps around muscle and invades through muscle and connects muscles to other muscles and muscles even to the skeletal system. It's a very important structural piece of anatomy, but there are times when it gets really adhesive and really sticky, for lack of a better word. Rolling through muscles with a foam roller, with a lacrosse ball, with a handheld tool can help unstick this tight connective tissue from muscles and allow muscles to move more freely like they're supposed to. So I'll go ahead and jump right into it. The first way that I've used that gets some really good release on the low back strap muscles is using a foam roller. So I'm going to go ahead and show you the technique. I'm going to start by sitting on the foam roller, and then I'm going to I'm going to roll my right back strap muscle. So just a word of caution, I'm not rolling directly in the middle of my back. The foam roller will not be on my spine or my vertebral bones. It will be off to the side. I'm going to tilt to the side so that the rolling will be done purely on the muscle. So with this, to get an added stretch, I'm going to bring my leg into a figure 4 type position. This is actually the same position you get into when you roll your glute muscles. And I'm going to be turning towards my right side, or towards this side where my leg is lifted. Now I'm going to roll up past my hip bone and onto the low back muscle. Again, I'm not in the middle on the spine. I'm off to the side, and this rolls over those back strap muscles. I can also rotate side to side, especially if I find a particularly tight area. But rolling on those backstrap muscles, this can be really nice and effective for releasing some tightness there. You can go all the way up till about the bottom of the rib cage. So I'm going from essentially the top of my pelvis above the bone just to the bottom of my rib cage, not a far area, about a hand's breadth's distance to get on those muscles. And again, going across the fibers as well as longitudinally is both really effective in helping open up some of those muscles. So the second way, that's the first way that I use those muscles, and that's probably the one I use the most. Now, I will use a lacrosse ball at times against a wall if I need to get into a very specific area. If there's a trigger point that is very difficult to get to, may be stubborn, it may be difficult to stretch, I will use a lacrosse ball and get specifically on that specific tender point or tender nodule or trigger point. So that can be a good way too. So just to demonstrate that very quickly, it's relatively self-explanatory, but you pin the ball against the wall using your body, and then you can simply roll side to side. You can roll up and down, and you can even just apply pressure by pressing your body into the wall and applying pressure on that specific tender point, tender nodule, trigger point, and that can be a really effective way, especially if it's in one specific area. So in recapping, the foam roller is better to get some release on the entire muscle, the entire low back muscle that's on the side of each side of the spine. And then if you have a specific area that you're trying to target or work on, a lacrosse ball might be better. You can also get a little bit more pressure in that specific area with a lacrosse ball. So those two ways I've found to be pretty helpful in releasing the low back muscles if they're particularly tight. Again, I'd recommend you check out my other two videos, the glute max and the hip flexor stretching and rolling videos. Really, for low back issues, those are the places I start, and this would be a nice third place to go after you work on those two things for low back tightness issues. But thanks so much for checking out the video. That's it for today. Feel free to leave a comment if you have a comment question. And thanks so much for tuning on, and I hope you subscribe to our channel for more content just like this about sports medicine, injury prevention, and the like. So thanks so much. Have a great rest of your day.